I'm Jennifer Woods. I'm the Chief Nursing Officer and Vice President of Patient Care Services at McLaren, Northern Michigan. And when we first started out collaboration with Banyan, I was losing sleep over my staffing. I think every CNO does at some point. We were at a point on several of my units that we were looking for a different care model, and the capabilities that Banyan offered really made a difference. It was unique, had not been seen before, and we were definitely positioned and willing to make a change and open our minds to something different. So that's really where we started. Over time, it's become something that's helping us retain staff. It still helps in our staffing model, but through a pandemic and even more limited resources, it's become a very useful tool for us. So we started with one unit. I had a team here locally that was my staff working with Banyan and working through the technology. Over time, we became a mixed group that we had a local, my staff as well as Banyan's team, the sync team, working together collaboratively to support multiple units. At this point, I have the technology in every one of my units, including some of our rooms in our emergency room, also helping to do our medication reconciliation, help with throughput there in preparation for the patients as they're being admitted to the inpatient units. So all of my inpatient units, we haven't fully deployed into our ICU. The technology is there. And we're looking at how best to support them, particularly in these times of nursing shortages, staff shortages all the way around. But that's the remaining location. We have some thoughts about utilizing the technology to help our surgeons as well with discharge timing and being able to connect with the patients. During the pandemic, we put pharmacists, case managers, our chaplains or pastoral care when they couldn't, to minimize their going into the rooms, so being able to help those patients stay connected, it became a very valuable tool. And so we continue to look at how we can hone those practices to maximize the use of Banyan's technology. Looking back at what we've been through a pandemic and how that all of a sudden became very popular, it became a really valid solution. But when we first started, there was reservation around the cameras and how they might be used. And it was really important for the direct care team to understand how it could enhance the effectiveness of the team, and that the professional that's on the other side of the camera is a professional and a part of their team, and to support them where they best can throughout the care continuum. So we got past that. We also helped to focus on the patient, and that as much as we want this to help them, that it also is enhancing our patient care, and that is meaningful to any care provider. And when they came to understand that, it became less of a concern. Plus, I think the features that Banyan has built in helps to provide some sense of security and management in terms of those cameras and how they're being used. So that helped as well. Whether they're local or they're with our sync teams, that they have your back. They're there for the patients when you aren't able to be. They're there to help you get through, the documentation, the required elements, help us stay on track with our clinical quality goals. And they're there as a resource as part of that clinical team. So I think there have been times due to technology that we didn't have them, or we've tried to adjust the model over time at different points. And the feedback that I got from the nurses at that point was like, wait a minute, where's my nurse? Where's my virtual nurse? So as they learn to separate out the key pieces of who's doing what on the team, when you don't have that team member, you feel it. And I think that's been acknowledged time and time again. It becomes an important part of the team. We've have challenges around an increasing need for observation on patients. So that's another piece that this could be very helpful with. I would say we've seen some positive movement with our falls, but we were in a good place. So largely, I wasn't expecting to see a huge difference there, but I do see a difference in the stress and distress from my nursing staff and being able to have eyes on their patients more regularly. So when they are taken away from their patients, they can collaborate with a virtual nurse or a safety companion or whomever we've built into that structure to help them with observation of patients as well. I would say that's probably our biggest improvement